Hi friends, I brought a new video for you. This video is going to be on Arinac Forte. Arinac Forte has 400 milligrams of ibuprofen and 60 milligrams of pseudoephedrine. It's made by Abbott Pharmaceuticals. The price for the box is 560 rupees and the box has 100 tablets in it. Arinac Forte has pseudoephedrine, which is used to relieve nasal congestion caused by colds, allergies and hay fever. It is also used to temporarily relieve sinus congestion and pressure. Pseudoephedrine will relieve symptoms but will not treat the cause of the symptoms or speed recovery. Pseudoephedrine is in a class of medications called nasal decongestants. It works by causing the narrowing of the blood vessels in the nasal passages. Ibuprofen is used to relieve pain, tenderness, swelling and stiffness caused by osteoarthritis, arthritis caused by a breakdown of the lining of the joints, and rheumatoid arthritis, arthritis caused by the swelling of the lining of the joints. It is also used to relieve mild to moderate pain, including menstrual pain, pain that happens before or during a menstrual period. Ibuprofen is used to relieve and reduce fever and to relieve minor aches and pain from headaches, muscle aches, arthritis, menstrual period, the common cold, toothaches and backaches. Ibuprofen is in a class of medications called NSAIDs. It works by stopping the body's production of a substance that causes pain, fever and inflammation. Arinac has ibuprofen and pseudoephedrine, which come as a regular tablet to be taken by mouth. The regular tablet is usually taken every 4 to 6 hours to help prevent trouble sleeping. Take the last dose of the day several hours before bedtime. Follow the directions on the package label or on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take Arinac exactly as directed. Do not take more or less of it, or take it more often than prescribed by your doctor. Swallow the extended release tablets whole. Do not break, crush or chew them. This medication is also sometimes used to prevent ear pain and blockage caused by pressure changes during air travel or underwater diving. Talk to your doctor or pharmacist for more information. This medication is sometimes prescribed for other uses. Foods and drinks that contain large amounts of caffeine can make the side effects of pseudoephedrine worse. Pseudoephedrine may cause side effects. Tell your doctor if you have any of these symptoms: restlessness, nausea, vomiting, weakness, headache, etc. Some side effects can be serious, such as nervousness, dizziness, difficulty sleeping, stomach pain, difficulty breathing, a fast pounding or irregular heartbeat. Pseudoephedrine may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. I hope this video was informative. Please like and share our channel, subscribe to our channel. Thank you.